Hi, my name is Angie Clark, and I'd like to talk to you about how transformational leadership theory and Kurt Lewin's change theory are able to be used by organizations to deal with the nurse retention issue. Although there are more nurses working today, there are still a projected shortage to occur, and part of that is based on nurse retention. Nurse leaders face many challenges in health care because they're trying to improve health outcomes despite having constant change in practice and less nurses. Turnover negatively impacts patient care in terms of quality and safety, nurse self-esteem, and nurse job satisfaction. We know that more deaths of patients are associated with less nurses working, so this is truly an issue. High nursing turnover is a source of stress for those nurses who are still working in healthcare and is a true loss of knowledge and experience that organizations can't quickly restore. Transformational leadership has been shown to positively impact healthcare and nurse retention, so organizations are faced with looking to see if their leaders have these transformational qualities and if followers can see those qualities in the leaders. This motivational style is connected with nurse empowerment, which we know is associated with a positive workplace culture, positive patient outcomes, and organizational commitment. Increased job satisfaction is described by nurses when they feel their leader helps to inspire and encourage them. Nurse leaders can use transformational leadership qualities with the change theory in order to help to have a successful change process. Unfreezing is the first phase. This is where you gather data, identify the problem, decide if a change needs to occur, and ultimately, are people willing to make that change, and do they see it as necessary? You want to identify restraining forces. These would be ones that discourage change. You also want to look at driving forces. These help to inspire change. The second phase of the change theory talks about moving and transition. This is a time where you form a plan with clear goals and objectives. You want to also determine methods to evaluate and modify change after implementation of your change process. Freezing and unfreezing is the third phase. This is when you reestablish equilibrium with the new norm after the change has occurred. And you want to learn how to do this through different processes. In order to have this kind of program, we're going to look at forming a leadership retreat, and we're going to learn how to be transformational leaders. This would occur one day every 6 months, and it would include both new and current nurse leaders in the organization. It would have an area of focus on 4 areas. Emotional intelligence. So you're going to work on helping leaders become more self-aware of themselves. They're going to work on collaboration. How can they work well with others to deal with a collective issue? Teamwork. You want to look at effective ways to build teams. And lastly, practice system change. We want to understand causes of resistance to healthcare change. In order to do this, we know that nurses are essential in providing quality healthcare, so any excessive turnover is very costly for an organization. So as far as using the change theory, we know that for the unfreezing, once the organization and nurse leaders have realized that a change in leadership style is needed, then the current status quo of leadership training, or lack thereof, is no longer supported with these increased nurse retention issues. So this starts the unfreezing process and allows for transition into a leadership change for this organization. So potential driving factors would be helping the leaders to see the value in learning self-awareness and learning how to work as team members. Restraining forces might be that nurses don't want to change. The leaders are happy with how they manage. It is a cost for the organization for the time away from work or during work hours. So it must be apparent that it is important for the organization to have this retreat in place. Then, once the implementation of a leadership retreat is actually done, then we should hopefully have transformation of these nurse leaders. This retreat needs to have planned, clear goals and objectives. We want the current leaders to be able to give feedback on what they would like to see happen with this retreat in order so that we can have them being empowered and that they can be a part of this change process. Nurse leaders need to receive training and coaching at this retreat in order to help them learn how to be transformational leaders and how to help change the mentality of the workplace. Freezing and refreezing would occur once a leadership retreat is established and considered the new standard for nurse leadership training for the organization. Input from staff nurses, along with retention statistics, are important outcomes that will help measure the success of this program on nurse satisfaction and nurse retention. Thank you.